Hey guys, and welcome back to The Upper Hand. My name is Parker. Today I'm going to take you through some isometrics of the thumb, and more specifically thumb column strengthening. We do this a lot with our patients with CMC arthritis. I'm going to explain a little bit more about why we do that and how to do that later in this video. So let's jump right in. So if this is your first time with us, we've done a series of videos on isometrics. We've done one on the shoulder, elbow, forearm, wrist, and fingers. Today we're wrapping up that series with the thumb. So again, just to review, an isometric is a contraction where the muscle is firing or contracting, however there is no movement at the associated joint. So an isometric contraction of the elbow would look something like this, where that muscle is firing, but there's no movement at the elbow. So we're going to talk about today how to do that for the thumb, the best ways to do that, and also some practical implications on how we treat a painful thumb when it comes into our clinic. Specifically when we're talking about CMC arthritis, so basically you've got the first metacarpal bone here, you've got the trapezium here. Both of those bones obviously line with cartilage. Over time, many years of use, that cartilage just slowly wears out. So eventually you start getting some bone on bone. Of course, that's going to hurt. And what do you do when your thumb hurts? You don't use it. Of course, that's going to lead to stiffness and less functional use of that thumb. It's really going to cause a lot of issues. All right, so let's go ahead and talk about these exercises, how to do them for you, or maybe even for your patient if you are a treating therapist. So a few of the isometrics that we like to do, and specifically this thumb column strengthening, first is called a C isometric. So you literally are going to make a C with your hand, with your thumb and fingers, or if this is your right hand, it'll be a backward C. But if it's your left hand, you're going to make a C, and you want to make sure that is a perfect C here, not a collapsed C of the thumb here, which is sometimes really hard for the patient to do. And also make sure the fingers aren't straight. So again, just make sure everything is kind of curled into that C position. And what you want to do is make sure that your thumb is also level with the index finger. So you'll want to be able to put a piece of paper right on top of it. So you don't want your thumb up here. You don't want it way down here. Okay, so first you're going to make that C position, and you're really going to tense everything up in that hand for about 5 seconds. 1, 2, 3, 4, 5, and relax. Go again. 1, 2, 3, 4, 5, and relax. And you can see all of those muscles there are really tense and tight. So what we're doing with this is basically strengthening all of the thumb column muscles, and we're going to strengthen those so that they can naturally kind of lift that bone off of the trapezium, that first metacarpal bone off of the trapezium, so that you can stop getting that bone on bone type feeling there, which is obviously a big source of the pain. So we'll go back to our C. We're going to do that for 10 times. We're going to hold it for about 5 seconds each time we're doing it. And what we typically do is we're going to start doing that for 3 or 4 times a day, making sure you're spreading those sessions out throughout the day. And what you want to do is when that gets easy, you want to either go up in reps by 5 reps a day, or say if that's really easy, you can go ahead and go to our next step, which is with a rubber band, which I'll show you next. Okay, so next step, once you have progressed past the isometrics for the C, you're going to get a little small rubber band, just like this, and we're going to put that around the hand, just like this. Some people will put it in between their index or their small finger and ring finger. That's fine. I usually just go all the way around the hand. And we're going to place that rubber band right past that MP joint, just so it doesn't roll back and forth on you. Sometimes you may have to get a thicker rubber band to keep that from happening, but you want to make sure that the rubber band is not too thick so that it's not too hard to perform this exercise that I'm about to show you. So again, we've done our C's. They are easy. You're ready to progress to something a little stronger. So now we're going to the rubber band. We're going to start same position, just kind of collapsed here, and we're going to go into that C position, but now we're going through just a slight bit of resistance here with that rubber band. Same concept, hold your 5 seconds, relax, go right back into it. Okay, and the last isometric exercise we want to show you is you're going to be working right here, this muscle here, the adductor muscle, and the best way to do that is to keep your hand straight. Put your opposite hand on top of your index finger, and we're resisting that index finger from moving out away from the palm or out away from the middle finger. So here, lift up, and if you have an extra hand or an extra finger, you can feel that muscle right there firing when you do that. So up, 1, 2, 3, 4, 5, and relax. Up, 1, 2, 3, 4, 5, and relax. You will feel that for sure if you do 10 of those, and it won't take you long to know that you're really doing something and strengthening that musculature here. So again, that's a really good way to help with thumb pain that is associated with CMC arthritis. So very short, sweet, simple, to the point. These are a lot of times beneficial to our patients, so we think they'll be beneficial to you as well. Give them a shot, let us know what you think, and we'll see you guys next time. Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So you know our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.